Hello, I'm Dr. Maury Markman from City of Hope, and in this week's segment of Minutes with Markman, I would like to continue the discussion I started last week on the topic of measurements in oncology and contrast the two measurements of what have been called the major goals of all anti-neoplastic treatments to improve overall survival and to improve quality of life. Now, when we discuss first overall survival, one may very appropriately debate, and I have done this in many forums, the ability to demonstrate improved overall survival in a randomized controlled trial because of compounding factors such as treatment after a patient has finished therapy on a trial. But the goal of that therapy is still to improve overall survival. And the point I am attempting to highlight here is not that controversy of the ability to demonstrate improved overall survival. Rather, the point to be emphasized is the specifics of the measurement itself. And there is no definitive endpoint in oncology or in any other aspect of medicine, I would argue, that is more definitive than the date of death. So, in a trial, one can say starting date is the day the patient is registered, or the starting date is the day that the patient gets the first dose of the drug, or the day that the surgery is performed. And the end date is the date of death, recognizing, hopefully, that many patients will not have died at the time that you're looking at results. And we have very valid, acceptable measures of censoring that particular endpoint if it hasn't been achieved. So, hard fact. The day you start some type of therapy, some type of intervention to the day the patient dies. That's overall survival. Now let's contrast that hard endpoint, objectively measured, no disagreement, to the second endpoint, which is quality of life. This is going to be a very brief discussion of this topic. There is so much to talk about when we talk about quality of life. It's used in clinical trials. But what I want to focus on here, briefly, is to highlight the striking differences between the measurements and their interpretation, overall survival and quality of life. First, what is quality of life? And specifically, what is the definition to be employed to decide whether in a clinical trial, for example, quality of life is superior, inferior, or the same between an experimental regimen, for example, and a standard of care? At what point should that question even be asked? Is it during or following therapy? And if it's following therapy, is it immediately following therapy? A year, 2 years, 5 years later? What is the point at which we say we have demonstrated superior, equal, inferior quality of life? To use all those points. And finally, what exactly should be included in patient-focused, and they have to be patient-focused, surveys of quality of life to determine if quality of life has been improved or not? Is it general questions of how a patient is doing or feeling? Or specific questions related to recognized symptoms in a particular tumor type? Or the therapies the patient may receive? Is it a combination of all of these? How does one evaluate? What is the definition, again, of superior, inferior, or the same? During a patient's cancer journey, quality of life becomes relevant at multiple points. Again, the purpose of this conversation is not to in any way minimize the importance of quality of life. It is critically important to the patient's family, and to all of us in terms of trying to determine whether therapy is worth it or not for our patients. The point to be highlighted is the difficulty in measurement, defining what should be measured, and interpreting the outcome. That's the point. In contrast, again, to the measurement of overall survival. So in the final segment of Minutes with Markman, dealing with measurements, I'd like to discuss another aspect of the topic of measurements. In this case, the number of prior regimens for entering into a clinical trial, and specifically in ovarian cancer. And I thank you for your attention.